everyone, my name is Cheyenne. I'm going to be talking to you today about the problems and concerns of drug addiction. What you may not realize is that drug addiction is all around you. You may not see it because some drugs are not as severe as others. Behind me is the chart from the CDC from 1999 to 2018 showing how much drug overdose deaths have went up. In 1999, it was below 20,000 of drug deaths in the United States. And as of 2018, over 67,000 people died that year of drug overdose. A drug is anything that can be injected, inhaled, or ingested into your body that changes your mental state of mind. There are legal and illegal drugs that can do this to you. Most people don't see it as bad as if it is a legal drug, but it's not good for you. Legal drugs consist of doctor-prescribed drugs such as opiates, which are painkillers, barbiturates, which are mental medications like Adderall that make you focus and all that, and benzos, which are depression, anxiety medicine that pretty much just put you to sleep so you don't have to worry about anything around you. Illegal drugs is what you get told all about growing up, like don't touch them, don't do this, don't do that. Well, growing up you don't really get told much about legal drugs because it's not looked at as bad because it's from a doctor. But illegal drugs consist of cocaine, marijuana, meth, LSD, heroin, anything like that. Why do you think most people begin doing drugs? A lot of times it began at a young age, and it is out of peer pressure, or it could be out of wanting to escape of reality. Most of the time with peer pressure, it's you're surrounded by your friends at a party or just at a house somewhere, and it's brought to your attention right there, and they're like, oh, do it. No, you say no. And if that's when it comes into a peer pressure, they look at you, or you think that they are like, oh, they're not cool, this, that, and the other. Well, you don't have to be cool to do drugs. You don't. And you don't have to do drugs as an escape or stress relief either. Because either way, when that high goes away, your problem is still there. So that's why most people, it turns into an addiction because they want to continue to not have to pay attention to this problem in their life. Drugs don't affect just you. They affect your friends, your family, your pets even, the whole public around you. I personally have experience with this. I have over 15 years of experience. I did not grow up with a mother. I grew up with a mother figure in the house, but I did not grow up with my mother. My mom used opiates, marijuana, and alcohol my whole life. She decided to get clean when I was 17 years old. Back then, when I was younger, I looked at her as the worst person in my life. But now I look at it, we have a much better relationship. I look at it as a lesson. I'm thankful that she was there, that she done the drugs in front of me so I can look around people and tell them, don't do it. It changes things around you, and it gives you a better perspective on drugs when you see it brought to your attention, like, do it. No, I'm not going to. I don't want to end up like that. Drugs affect the abuser in many different ways. Different drugs affect them in different ways. How they're taken, how long they're taken, reasons, like with their health. There are short-term and long-term effects of drugs on the abuser. Short-term can be appetite, sleep problems, heart rate, blood pressure, anything in that sort. Long-term can be lung, heart disease, cancer, death, I mean, you can get any kind of HIV, AIDS. You can get a whole bunch of things from drugs that you don't realize. You can prevent drugs by just saying no. Stay away from that crowd. You can start an early intervention if you know somebody that is around drugs or they may try them. They have programs all around you that would love to help. And just teach young children or the younger generations about drugs, whether it's legal or illegal, so they do stay away from them. Thank you.